they've studied it for truncal veins up to, I believe, 25 millimeters in diameter, which is a very big vein. Yeah. We generally don't see them that large. So they've studied it up to veins that are much larger than we typically see. But what I would consider a big truncal vein would be something maybe 10, 12, maybe 15 millimeters in diameter. And they've studied them for veins up to 25 millimeters. Yeah, I would say involved procedure. Yeah, it was still non-surgical, and still do plenty of catheter procedures. Still, depending on the patient, depending on the appropriateness, I will use the Varithena on some of them, but others I will still use the catheter. But as we get more and more comfortable with the Varithena and seeing good results, I suspect we're going to be more comfortable shifting over to more and more of these saphenous veins that have reflux and extensive reflux, and just using the Varithena instead of the catheter. So it is nice in that regard, and that's one of the things I really like about it. As I mentioned before, it's new, so we have to take our time and make sure it's going to be effective for all of the things that we want, the results that we want to see for our patients. But if they continue to have good results and good feedback, and in our studies, with the Center for Vein Restoration, we're a large company. We have a lot of doctors around the country, and we see a lot of volume, a lot of patients with vein disease. So we have the data to look at. So as that data gets looked at and analyzed, and we have the follow-up, not only the short-term follow-up, but the long-term follow-up for those patients, then I think we're going to feel more and more comfortable using Varithena for more extensive disease and for larger procedures on these truncal veins.